What is bipolar disorder? Bipolar disorder, also known as manic depression, is a mental illness. It brings severe high and low moods and changes in sleep, energy, thinking, and behavior. People who have bipolar disorder can have periods in which they feel overly happy and energized. They too may have other periods of feeling very sad, hopeless, and sluggish. In between those periods, they usually feel normal. You can think of the highs and the lows as two poles of mood, which is why it's called bipolar disorder. Most people experience mood changes at some time, but those related to bipolar disorder are more intense than regular mood changes, and other symptoms can occur. The word manic describes the times when someone with bipolar disorder feels overly excited and confident. These feelings can also involve irritability and impulsive or reckless decision-making. About half of people during mania can also have delusions, believing things that aren't true and that they can't be talked out of. On the other hand, they may have hallucinations, seeing or hearing things that aren't there. Hypomania describes milder symptoms of mania. Most people with bipolar disorder spend more time with depressive symptoms than manic or hypomanic symptoms. Types of bipolar disorder. There are three main types of bipolar disorder: bipolar I, bipolar II, and cyclothymia. 1. Bipolar I is defined by the appearance of at least one manic episode. You may experience hypomanic episodes, which are less severe than manic episodes, or major depressive episodes before and after the manic episode. This type of bipolar disorder affects people of all sexes equally. 2. People with bipolar II experience one major depressive episode that lasts at least 2 weeks. They also have at least one hypomanic episode that lasts about 4 days. This type of bipolar disorder may be more common in women. 3. People with cyclothymia have episodes of hypomania and depression. These episodes involve symptoms that are shorter and less severe than the mania and depression caused by bipolar I or bipolar II disorder. Most people with this condition only experience no mood symptoms for 1 or 2 months at a time. 4. Unspecified or other specified bipolar disorder, formerly called bipolar disorder not otherwise specified. It is now used to describe conditions in which a person has only a few of the mood and energy symptoms that define a manic or hypomanic episode. It may also apply to if the symptoms may not last long enough to be considered as clear-cut episodes. 5. Rapid cycling is not a type of bipolar disorder, but a term used to describe the course of illness in people with bipolar I or II disorder. It applies when mood episodes occur 4 or more times over a 1-year period. Women are more likely to have this type of illness course than men, and it can come and go at any time in the course of bipolar disorder. Rapid cycling. Rapid cycling is driven largely by depression and carries an increased risk for suicidal thoughts or behaviors. 6. With any type of bipolar disorder, misuse of drugs and alcohol use can lead to more episodes. Having bipolar disorder and alcohol use disorder, known as dual diagnosis, requires help from a specialist who can address both issues. Symptoms of bipolar disorder. According to the International Bipolar Association, symptoms vary between individuals. For some people, an episode can last for several months or years. Others may experience highs and lows at the same time or in quick succession. 1. Mania or hypomania. Hypomania and mania are elevated moods. Mania is more intense than hypomania. Symptoms can include impaired judgment, feeling wired, sleeping little but not feeling tired, a sense of distraction or boredom, missing work or school, underperforming at work or school, feeling able to do anything, being sociable and forthcoming, sometimes aggressively so, engaging in risky behavior, increased libido, feeling exhilarated or euphoric, having high levels of self-confidence, self-esteem, and self-importance, talking a lot and rapidly, jumping from one topic to another in conversation, having racing thoughts that come and go quickly, and bizarre ideas that the person may act upon, denying or not realizing that anything is wrong. Some people with bipolar disorder may spend a lot of money, use recreational drugs, consume alcohol, and participate in dangerous and inappropriate activities. What are the early signs of bipolar disorder in children and teens? 2. Depressive symptoms. During an episode of bipolar depression, a person may experience a feeling of gloom, despair, and hopelessness, extreme sadness, insomnia and sleeping problems, anxiety about minor issues, pain or physical problems that do not respond to treatment, a sense of guilt, which may be misplaced, eating more or eating less, weight loss or weight gain, extreme tiredness, fatigue, and listlessness, an inability to enjoy activities or interests that usually give pleasure, difficulty focusing and remembering, irritability, sensitivity to noises, smells, and other things that others may not notice, an inability to face going to work or school, possibly leading to underperformance. In severe cases, the individual may think about ending their life, and they may act on those thoughts. Psychosis. 3. Psychosis. If a high or low episode is very intense, the person may experience psychosis. They may have trouble differentiating between fantasy and reality. Psychosis symptoms during a high include hallucinations, which involve hearing or seeing things that are not there, and delusions, which are false but strongly felt beliefs. A person who experiences delusions may believe they are famous, have high-ranking social connections, or have special powers. During a depressive or low episode, they may believe they have committed a crime or are ruined and penniless. Causes and risk factors. Bipolar disorder is a fairly common mental health condition, but experts have yet to determine why some people develop the condition. Some potential causes of bipolar disorder include genetics. If your parent or sibling has bipolar disorder, you're more likely to develop the condition. Brain, irregularities in brain chemistry, or the structure or functions of your brain, may increase this risk. Environmental factors. It's not just what's in your body that can affect your chances of developing bipolar disorder. Outside factors can also play a part. These might include extreme stress, traumatic experiences, physical illness. Is bipolar disorder hereditary? Genetics can play a big role in the development of bipolar disorder, particularly among immediate relatives. If you have a parent or sibling with the condition, for example, your risk of developing it is about 10 times higher. Can it be prevented? Once you begin to experience mood episodes, you can take steps to help reduce the severity of those episodes and lower your chances of experiencing additional mood episodes. Common co-occurring conditions. Some people with bipolar disorder also have other mental health conditions. A 2019 research suggests that anxiety disorders are among the most common. Other conditions that might occur alongside bipolar disorder include substance use disorders, eating disorders, specific phobia, ADHD. Symptoms of these conditions might show up more severely depending on your mood state. Anxiety, for example, tends to happen more commonly with depression, while substance use might be more likely with mania. If you have bipolar disorder, you may also have a higher chance of developing certain medical conditions, including migraine, heart disease, diabetes, thyroid disorders. How is bipolar disorder diagnosed? A diagnosis of bipolar disorder is made only by taking careful note of symptoms, and their severity, length, and frequency. The most telling are periods of hypomania or mania. What are the treatments for bipolar disorder? Bipolar disorder is a long-term illness that requires management throughout a person's life. People who have numerous, 4 or more, episodes of mood changes, rapid cycling, in a year can be much more difficult to treat. Medication. Medication is the primary form of treatment, but the additional use of psychotherapy or talk therapy is sometimes recommended to help prevent future episodes. There are many drugs available to treat bipolar disorder. Proposed guidelines for treatment options are based on the three main phases of bipolar disorder. They include the acute manic/mixed mood states, acute major depressive episodes, and finally the continuation/maintenance phase. As a general rule, avoiding antidepressants and taking two mood stabilizers has proven to be an effective strategy for most patients. Mood stabilizing drugs. Lithium is a mood stabilizing drug. It has proven helpful in controlling mania and depression and preventing depression and manic episodes. Lithium will reduce symptoms of mania within 2 weeks of starting therapy, but it may take weeks to months before the condition is completely controlled. Thus other drugs like antipsychotic drugs or antidepressant drugs may also be used to help control symptoms. Common side effects of lithium include frequent need to urinate, weight gain, increased thirst, slight trembling of the hands, nausea. Thyroid and kidney problems are a concern, so your doctor will monitor the function of your thyroid and kidneys. He will also monitor the levels of lithium in your blood since levels can easily become too high. Anything that lowers the level of sodium in the body, such as switching to a low-sodium diet. Heavy sweating, fever, vomiting, or diarrhea may cause a buildup of lithium in the body and toxicity. The following are signs of a lithium overdose. Call your doctor immediately if you experience blurred vision, irregular pulse, extremely fast or slow heartbeat, difficulty breathing, confusion, convulsions, dizziness, severe trembling, need to pass large amounts of urine, uncontrolled eye movements, double vision, unusual bruising or bleeding. Anti-seizure medications. Valproate is an anti-seizure medicine also effective for controlling mania. It is also effective for people with rapid cycling bipolar disorder. The drug has some side effects, can cause inflammation of the liver and can decrease the amount of platelets, blood cells needed for blood to clot, that the body makes. Your doctor will monitor levels of valproate as well as liver function and platelet counts. Common side effects of valproate include sedation, stomach cramps, diarrhea, indigestion, nausea, weight gain, slight trembling of hands. Other anti-seizure medicines often used to treat bipolar disorder include carbamazepine, Tegretol, and lamotrigine. Lamotrigine is used alone or in combination with other mood stabilizer medications. It is more effective at treating the depressed phase of bipolar and/or as a mood stabilizer to reduce cycling. Lamotrigine is available as a generic drug. It is very well tolerated and is free of side effects for most patients. Side effects. Serious side effects of lamotrigine you should report to your doctor include rash, worsening depression or suicidal thoughts, flu-like symptoms, such as body aches or swollen glands. Atypical neuroleptics. This class of medications is sometimes classified as antipsychotics but is also effective in treating bipolar disorder, mania and depression. These include medications such as olanzapine, quetiapine, aripiprazole, lurasidone, ziprasidone, iloperidone, brexpiprazole, cariprazine, clozapine, risperidone among others. Common side effects of these medications include tremors, muscle spasms or contractions, involuntary movements, weight gain, increased glucose and lipids, sedation, irregular, jerky movements, rigidity, slowness of movement, symptoms known as extrapyramidal symptoms. Most people with bipolar disorder take more than one medication. In addition to a mood stabilizer, patients may take a medication for agitation, anxiety, insomnia, or depression. Many antidepressants can be used with mood-stabilizing drugs to manage the depression of bipolar disorder. If used alone, an antidepressant can push a person with the condition into a manic state. Additional treatment options. Other treatment options your doctor may consider include stimulants are sometimes used to treat depression. Thyroid medications can act like mood stabilizers. Studies have shown positive results in reducing symptoms in female patients with hard-to-treat, rapid cycling bipolar disorder. Light therapy uses a light box that gives off a bright light similar to natural sunlight. It can be used to treat depression. Electroconvulsive therapy, ECT, passes electric current through the brain to treat severe depression. Transcranial magnetic stimulation uses a short electromagnetic coil to pass electric current into the brain. Used to treat depression in patients in whom medication has not worked and is an alternative to ECT. Vagus nerve stimulator is a device implanted under the skin that sends electrical pulses through the vagus nerve, a nerve that runs from the brainstem through the neck and down to each side of the chest and abdomen. The pulse has been found helpful in treating depressive symptoms. Ketamine treatment, given intravenously, along with other medicines, has been shown to be helpful in treating bipolar depression. Can bipolar disorder be prevented? There is no known method to prevent bipolar disorder. Because its exact cause has not yet been determined, it is especially important to know its symptoms and seek early intervention. Regular and continued use of medication can help reduce episodes or mania and depression. Some people who experience bipolar disorder may become suicidal. By knowing how to recognize these symptoms, there is a better chance for us to evolve effective treatment and methods how to cope up with